Hi there, my name's Carolyn Whiskin and I'm a clinical pharmacist at Charlton Health. I'm happy to be able to demonstrate the proper technique for opening an ampule of triamcinolone hexacetonide, known as Trispan. For some time, we had difficulty accessing this product, so we are very grateful to Medexus for bringing this to Canada. For many years, Trispan has been known as the intra-articular injection of choice by our pediatric rheumatologists. And this is because it lasts much longer in the joint due to its crystalline structure, which is slow releasing. And that is such an asset for little ones when having to do an injection. But this is a great benefit for our adults as well. During a pandemic, we want the least amount of in-person visits possible. And having this longer duration means less frequent injections. For some, in clinical practice, we have seen the injection last well beyond the 3 months we standardly see with our other steroid injections. 4, 5 months, even longer between injections may be all that's required. This reference sheet outlines the indications for triamcinolone hexacetonide. These include rheumatoid arthritis, juvenile idiopathic arthritis, osteoarthritis and post-traumatic arthritis, synovitis, tendinitis, bursitis, and epicondylitis. And this is for intra-articular, intrasynovial, or periarticular use in both adults and adolescents. In our pediatric population, it is approved for ages 3 to 12. This chart of standard intra-articular corticosteroid joint injection doses compares triamcinolone hexacetonide, shown in yellow, and triamcinolone acetonide. What you can see is that for Trispan, half the amount of medication is required for equal efficacy in pain relief, while offering a much longer duration of action. In order to break open the ampule, we first need to flick the top to ensure all the liquid has dropped to the bottom. Look for the blue dot, which must be facing you when breaking the ampule. Many of us learn the technique of taking an alcohol swab, putting it over the top of an ampule, and breaking it by pulling it towards us. That is not what we do in this case. We look at that dot, and we are going to be breaking away. So if you like the idea of actually using the packaging of which the alcohol swab is in, you may want to push the whole thing over top, cleaning well, keeping in mind that dot is here, and now I'm going to break it by pushing away. Another strategy for opening the ampule is to, after flicking and cleaning, use the adapter provided by Medexus to open the ampule. I personally like the dexterity of feeling the amp with my thumb and forefinger, either direct or through the alcohol swab, but this is another option. You would put this directly over the top of the ampule, and again, we are pushing that blue dot away from us. So thumb at the front, forefinger behind, firmly holding the amp, and a press away. Sometimes the top of the ampule may fall out as you do this. That is not a problem. You can release here and dispose of that glass piece inside your sharps container. An advantage of an ampule over a vial with rubber stopper is the same needle that you withdraw the liquid from, you can use for the injection. Where by using a rubber stopper, the needle is dulled by going through the stopper, and many would switch the needle before injection. As always, we dispose of the top of the ampule in our sharps container. Thank you so much for joining me today.